So will be times 2 for boys and girls. It will be 104 wash stations that will be installed in the whole of Ras subdivisions. And in coming years, we've been assured by the Punjas Group Company, the whole western region will be having these wash stations in their school. Thank you very much.
Distinguished guests and the esteemed members of the press, it is my honor to extend a warm welcome to each of one of you this morning. The battle against bacteria in the Western Divisional School, instigated by the Ministry of Health and supported by Ocean Soaps last year, was aimed to reduce the increasing incidences of communicable diseases such as typhoid fever in the Rao province. Last year, we participated in the program along with the Ministry of Health to target school children in 42 schools in the Rao province. We provided the program with our bodyguard antibacterial soaps to teach the students how to wash hands correctly and effectively, when to wash the hands to maximize effectiveness, and why they should wash their hands regularly and consistently. I'm sure you all are aware that this year marks the 80th year of service by Punjas to the people of Fiji. And to mark this milestone in our history, we are giving back to the community in recognition of the support which we received for the last 8 decades in a variety of ways that support healthy lifestyle choices. We believe that there is no better way than our continued support to this Ministry of Health initiative to extend the implementation of sustainability of a hand washing program within our schools to improve the health and well-being of the communities in the Western region. Ladies and gentlemen, I have much pleasure in calling upon the Honorable Assistant Minister Veena Bhatnagar to address you this morning. Thank you.
Once again, a very good morning to you all. And of course, it gives me a great pleasure to be here as your chief guest this morning on this very important occasion. I'm really honored to be here amongst you. Communicable diseases has been a challenging issue that continues to be a global threat year after year. The health departments around the world enthusiastically carry out their duties to safeguard the health of the people and at the same time promotes healthy living. This is nothing new compared to what the Ministry of Health is practicing in Fiji. Communicable diseases spread from one person to another or from an animal to a person. The spread often happens via airborne viruses or bacteria, but also through blood or other bodily fluid. The terms infectious and contagious are also used to describe communicable disease. In Liberia and of course other countries, they are currently facing the spread of Ebola virus, and hundreds of innocent people are suffering and even face death. We are fortunate that we only have diseases such as typhoid, leptospirosis, and dengue fever, which are not extreme as Ebola. The question is, what do we do when we get a communicable disease? When a person becomes sick with a communicable disease, it means a germ has invaded their body. Germs fear soap and water. Washing your hands well and often is the best way to beat these tiny warriors. Actually, hand washing with soap eliminates 99% of the bacteria and other infectious organisms that can cause disease. Health of children is paramount to the government of the day, and we must see that every child is educated on this good hygiene practice. The benefits for hand washing drill in schools and creating awareness on the importance of washing hands before eating and after visiting sanitation facilities has made a huge impact in the decline of communicable diseases such as a typhoid fever in the Western Division itself. Human feces are the main source of pathogens. They are the cause of many waterborne diseases, and pathogens are passed from an infected host to a new one via various routes, but all of these illnesses emanates from feces. Washing hands with soap after contact with fecal material after using the toilet prevents the transmission of the bacteria, viruses, and protozoa that are the cause of many such diseases such as typhoid. Other measures such as food handling, water purification, and fly control have an impact on these diseases as well. But sanitation and hand washing with soap is the most effective means of controlling communicable diseases as a means of personal hygiene. Ministry of Health and Medical Services, especially Western Health Services in partnership with the Punjas Group of Companies, are promoting personal hygiene in children by distributing free antibacterial soap. Of course, we acknowledge the Ocean Soaps Limited here. And today's launching is an integration approach between Ministry of Health and Medical Services and Ocean Soaps Limited, who have been generous in donating Bodyguard antibacterial soap for the entire primary school in the Western Division. Since last year they have been doing this. Moreover, the installation of wash stations by Ocean Soaps Limited and Punjas Group and Company in all the primary schools of Rakiraki subdivision, altogether 92, which includes boys and girls ablution block, has brought drastic decline in the behavioral change of our children at school in washing hands after visitation of ablution. The school students are targeted since they are instrumental for behavioral change. I have always believed in this, that our children, we can mold them in whatever way we want to. And if we have to bring about a change, our target must be our children. Because it's difficult to change an adult mindset, but I've always believed that it's very easy to, mold a child. And that is why, once again, I mention here that the behavioral change of our children at school in washing hands after visitation of ablution actually has taken toll. They are actually changing to the positive, towards the positive behavior, and of course it is helping them a lot. That is why there has been a drastic decline in the drastic decline in the typhoid in the Western Division. The school students are targeted since they are instrumental of behavioral change, as I mentioned, and the challenge is to transform hand washing with soap before eating and after using the toilet into an ingrained habit, from an abstract good idea into an automatic behavior performed in schools, homes, and respective communities. I would like to take this opportunity to thank Punjas Group and Company, Ocean Soaps Limited, for their generous support to Ministry of Health and Medical Services and the continuation of the sponsor of soap for the year 2015 for whole of Western primary schools and installation of hand washing drill and wash stations for the Singatoka primary school. There is altogether 104, including boys and girls ablution block. And ladies and gentlemen, may I take this opportunity to once again thank the sponsors, the Punjas Group of Companies, and of course Ocean Soaps Limited, for their continuous support and challenge other stakeholders to come on board, as health is everybody's business. With these words, ladies and gentlemen, may I wish you all the very best in today's launching, and hope that this hand washing program will bring a positive health impact to our communities. May God bless you all. Thank you. Dhanyawad and shukriya.
Thank you. Here you go.